I identify as a petite, cisgender, heterosexual, single, Christian, African-American, female of Cameroonian descent. Um, I'm an attending child and adolescent psychiatrist at CSG of CHKD, and my areas of subspecialty, crisis management, and provision of intermediate levels of care services. My passion for psychiatry started with a desire to be in the mental health care field and either to pursue psychology or psychiatry. I had to make that decision in my last few years of college. Prior to that, I always thought maybe I'll just do something in biology or chemistry. And then I took the psychology, fundamentals of psychology course, and I really enjoyed it. It explained human behavior and development, and it just explained a lot of things and thought processes. Um, it pretty much provided answers to a lot of questions I had. And so at that point in time, I knew that I wanted a career in mental health care, but I didn't know which route to go. Did I want to pursue a PhD in psychology, or did I want to go to medical school and pursue child psychiatry? Because I was actually quite drawn to children. So that was the decision I made, because I knew that I could do a lot more than just provision of therapies. I could also prescribe medication for children who needed it. That's why I went to medical school. So I had an interest in child psychiatry in college, specifically because I had the opportunity, one, to reflect upon my personal experiences as a child who migrated to the US during my teenage years. And then I also had the opportunity to work in a residential facility where you had autistic kids, and I realized how their behaviors could be changed with therapies like ABA therapies. So my exposures to things that I knew could be changed were to children. And so that's how I got interested in child psychiatry specifically. I've been involved in ACAP for 10 years now. First as a medical student, and then as a resident, then fellow, and now an attending. I would say initially it started with me attending, like listening to didactics that I enjoyed at the conferences. And then I was a monitor in 2014. I was a resident monitor at ACAP. And then in 2017, I became part of the ECP as a participant, and later became a member. And I also got involved in the emergency psychiatry committee as an active participant for 3 years or so. That's 2018 to 2021. Most recently, I've been an active participant in the Systems of Care Committee, in the Psychopharmacology Committee, the Black Caucus, and those are all places that I've found I've gotten a lot of support from. I've learned a lot about how leaders in that field think and what they're working on, and I also get to participate in some of their presentations. So it's been an amazing journey. I've also attended the AdPERT program once. I went to the conference in March of 2017, and it was their brain conference. So that was the conference where they did their National Neuroscience Curriculum Initiative. It was a great learning opportunity. From there, I actually learned how to write curriculums, because I was able to work on the pediatric neurology curriculum for fellows in my institution in 2017. So that was really a great experience. I just feel, I don't have a specific story to share, but I would say I feel I'm part of a group of people who have the opportunity to develop rapport with children. And that is very rare. It's rare to work in a field where you get to get into the world of a child and not just build rapport with them, but also with their families and help guide them to get whatever treatment they need to be able to move on with their lives and continue to grow and develop and thrive and eventually become productive members of society. So I think it's a great field. There's no better reward than seeing your patient get better and not need you anymore. And I find that happening a lot in child psychiatry. There's some kids who have severe mental illness and would need a psychiatrist for the rest of their life. But I would say a good portion of kids just need assistance for a brief period of time. And if they get the right care that they need, they're able to bounce back and not need you anymore. And so I could not recommend another field. It's a field that keeps you forever young. It's a field that requires you to tap into your humanity all the time. And I absolutely love it. Definitely, there were challenges throughout the journey. Before going to medical school, I would say I did not really have anybody to look up to or to guide me or even help me with the decision of whether to pursue medicine versus psychology. I kind of had to figure that out by myself. During medical school, I had to adapt to living far away from my support system. The rigor of medical school, never enough time to learn all the things you want to learn, and endless exams. So that's during medical school, as well as during residency and fellowship. There's lots of, you have to study for the boards, you have exams along the way that you have to take. So it is a challenge, but if it's something that you love, you can definitely pull through. And after realizing that the struggle still continues, passing your boards is not all that it takes. You also had to learn to work in an environment where you might be the only person of color. You might be the diversity, and also learning how to navigate things like microaggressions, things like fighting for equity, for the care your patients receive, and things like that. So the struggle continues, is just a different direction. Family support, specifically my mom, even though she's continents away, thanks to technology, we're able to communicate. Peer support, so my co-residents, co-fellows, they were very good, supportive group of people to kind of share experiences with and bounce back ideas. My Christian community, as well as my mentors. I've had lots of mentors, some who know they're my mentors and some who don't know. But they definitely inspired me to keep on going. ACAP is a place filled with several mentors for me. I have mentors within the Black Caucus. I can mention some of the names. Dr. Almartine is one of them. Dr. Otas is one of them. Dr. Fortuna is one of them. And I hope I'm not leaving anybody out. It's not intentional. It's just... and then the presidents, the ACAP presidents I've had the past couple of years have been pretty head-on advocating for rights of patients and for diversity, equity, inclusion, social justice. So Dr. Ian, Dr. Carlson, so lots of mentors, and that's at ACAP. And then there's mentors in some of the institutions I've worked at. One of my very good mentors is Dr. Wilson. So yes. So Dr. Wilson was a mentor during my my residency. He was an internal medicine director, and he really enabled me to do certain things I was passionate about that made the inpatient unit a lot more pleasant for the kids. For example, I literally designed the walls of the inpatient unit, which were initially white, and I bought stickers and decorated the entire place. He paid for it. I mean, but my point is, he allowed me beautify the place alongside the kids. Little things like that that make the inpatient unit a lot more friendly. And it's not just a whole place to treat kids, but it's a place where kids can also explore. Kids can also feel at home. So that's one example. I would share that having the opportunity to work on the Migrant Youth Institute with Dr. Fortuna has been an amazing experience. And it's something I'm looking forward to at ACAP this year. She's been a great mentor. Just the vision and passion of our president's Dr. In's capturing belonging, right after going through what I'll call the Black Lives Matter movement, where people felt, like they were not included because they were not. And so bringing that as his major initiative was great. The opportunity to help shape the next generation of physicians is something I take very seriously and I really enjoy, because there's nothing better than going to work and treating your patients and seeing them get better, but also knowing that you're helping mold this next generation of child psychiatrists, or let me rephrase that, of physicians. Whether they choose psychiatry or not is a different topic, but at least helping them see what psychiatry is all about and the joy in the field. Well, it definitely comes to mind in many ways. As a provider, I would say when I see certain minority patients, they feel relieved to have a provider who gets it. And it's not just minority patients who look exactly like me, it's just minority patients. Because it's just something about understanding, for example, what it means to be poor, understanding what it means to be a migrant, understanding the challenges that people face. So it just makes them feel more heard, more that the physician is more minded about the realities and the challenges that they face. I would also say sometimes some patients don't want to be seen by me because of my skin color or my accent, and that is sad for them because they're
missing out.
Yeah, they're missing out. There's no growth from the experience of 2020. But I hope everybody has learned a little bit more about the importance of diversity and inclusivity. But, so anyway, so that's that. And then there's also your working environment, right? So you get to see, you think about how can I share more about my experiences so they make decisions that, so that the institutions make decisions that includes all, like everybody's voice gets heard. So I definitely think about it. I would say that in high school, I had no idea what I was going to do. My favorite subjects were English, literature, and history. And in college, I shared earlier about my love for the field of psychology. So what I'm trying to say is, even if you are undecided about what you want to do with your life in high school and most of college, you can still stop and think, and is this a path I want to go through? And do I want to join and add more to the field of child psychiatry, because it is a great field? I would like to share that in our field currently, there's a major shortage of providers. And I think part of the reason why, there are many reasons for that, but part of the reason why is that there's not been enough videos or enough information about the field shared to the youngsters. So my hope is that by seeing this video, you would reach out to people like me to learn more about what we do so that it's something you would consider in the future.